a Meccan One at the UCLA School of Nursing, and I'm also a violin teacher. The title of my research project is Wait, Wait, Ready, Go! How Music Helps Children Grow. And I was interested in this topic because it has personal significance to me. I've personally experienced how music has helped me grow cognitively and emotionally, helped me deal with the stressors of growing up in a household of low socioeconomic status. And as a violin teacher, I've also seen how it helps my students grow cognitively, helps improve their self-esteem and regulate their emotions. So I was interested to see if there's any research out there speaking to if music can help improve physical health outcomes in addition to emotional and cognitive health outcomes in children. Um, and this research question is very important because wellness in childhood is a predictor of health across the life course. So investing in interventions that improve childhood health have long-lasting population health benefits. So I conducted my search through PubMed, and I used synonyms for health, children, music, and intervention. And I also considered 8 articles from a prior narrative review on the same subject. That narrative review was actually done through my population health class with Dr. Kristen Choi, and I'm so grateful to her because it's really because of her that this project has come to fruition. And so what I found was very interesting. I found that music is able to improve health outcomes physically, emotionally, and cognitively. I found several articles that spoke to how music helped improve quality of life in pediatric stem cell transplant patients, as well as lower their heart rate, which we know is a marker for anxiety. I also found many articles about how music therapy reduces pain and anxiety in children undergoing oncology treatments. And this again was measured through biomarkers, through questionnaires, and it's just very conclusive evidence that music can actually alleviate these physical ailments, the pain that comes with physical ailments. And so one interesting thing to note is that it's not simply playing music, but it's musical engagement. So as you can see from the picture in the centerfold, this patient is actually playing along with the volunteer. So it's not simply playing the music, it's engaging in the music, making the music. Other interesting results I found is that music can improve sleep quality, parent-child bonding. It has a huge effect on neuroplasticity, IQ, EQ, which is emotional intelligence, and self-esteem. And in children as young as a few months old, it has been found to improve their emotional intelligence. So this is really quite remarkable to me that music has the potential to change health outcomes as young as in children who are just a few months old. And finally, it decreases depression, stress, and anxiety, as well as schizophrenic symptoms. And this has a lot of really big implications because, as we know, stress is linked to many chronic conditions such as diabetes, obesity, and more. So how can nurses help? What nurses can do is they can point their patients to free music education organizations. Some that I want to highlight are the Harmony Project. This is an organization dedicated to providing free musical education all across LA for children who come from low socioeconomic backgrounds. And Youthphonics, which is an a cappella group I founded at UCLA 12 years ago that brings free music education to underserved schools in LA. There's also Medleys, which is a group at UCLA, an a cappella group that goes and sings at hospitals around LA. And as nurses, we can reach out to these groups and invite them to come to our practice settings to sing and lead therapy for our patients. And another way nurses can help is to actually spearhead these music therapy programs. Cedars-Sinai has a really great one called Music for Healing, and I hope to implement the same kind of program wherever I work so that patients can benefit from this. So thank you so much for listening to my abstract. I want to thank my parents for giving me the gift of music lessons, my faculty advisor, Dr. Kristen Choi. Without her, this project would not be possible, as well as Dr. Benisa Salem and my classmate Adam Shahar for helping me with the design of the poster, and of course, my students who really inspired this project. Thank you so much.